Hi, my name is Dr. Paige Gainey, and I'm with Total Hearing Care of Dallas. We have 4 locations to conveniently serve you. We have our Glen Lakes office, which is off of Walnut Hill Lane and 75. We have our Abrams and Mockingbird office, our Coyton Campbell office, and also our East Lake Garland office. Today, I'm going to talk to you about the 10 signs of hearing loss. So symptoms of hearing loss, they aren't always easy to detect. Symptoms often develop gradually, and your brain learns to adapt. You might not even notice there's anything wrong until your condition has advanced. Most of the time, friends and family will first notice the loss before you notice it yourself. Learning to recognize the signs early will improve your odds of successful treatment with hearing devices. We're going to go over one of the first examples of hearing loss. So people seem to mumble whenever they speak, and I love this graphic because this is what perfect hearing looks like. And then to the right of it, it has what hearing loss looks like as far as a visual representation. So you can see how this can be whenever patients with hearing loss think that other people mumble. The second sign of hearing loss is that you often ask people to repeat themselves. And I love this meme because it says, not sure if I should ask them to repeat themselves or just say yes. I had a patient come into my office the other day and she said, oh my gosh, Dr. Gainey, I might have just signed my whole life away and all of my possessions because I just couldn't hear or understand what they were saying. The third example of a sign of hearing loss is that you experience tinnitus or ringing in your ears. Tinnitus can come in many different forms. It's not just ringing. It can be buzzing, roaring, hissing, cicadas. And 1 in 5 Americans actually suffer from tinnitus. And there's many different causes of tinnitus. One can be aging, head injuries, medical medications, and also earwax buildup, okay? A lot of times if you have tinnitus, that can correlate with hearing loss. The fourth example here is that others may complain to you that you are listening to music or the television too loudly. So this is an important one because whenever you're watching television with your loved one, or say your family comes over after dinner and you have the TV up, and they say, whoa, that's just too loud. And that's one of the signs that, hey, maybe I need to get my hearing checked. Hearing devices can actually improve significantly understanding television. The fifth reason why you would want to get your hearing checked is if you have difficulty hearing everyday sounds, like ringing doorbells or chirping birds. And the reason why this is kind of an important one and it hits home close to me is that my grandmother, my granny, she had difficulty hearing those sounds around the house. And the first thing that I noticed was that she couldn't hear the oven alarm and the tea kettle going off. And so that was one of the signs when I said, you know what, maybe we need to get Granny's hearing checked. So the sixth sign is if you have difficulty following conversations in a large group setting. So whenever you're at a restaurant or it's your birthday party or you have family over during the holidays and you notice, oh my goodness, I'm having a little bit of difficulty following the conversations. I see over here that my son laughed at the joke in time and I'm still having difficulty kind of processing what is going on. That is one of the number one signs that a patient is having some issues hearing. The seventh sign is that you have difficulty when you're not facing the speaker. So I know that everybody this past year and a half or so with COVID, we've all been wearing masks. And what masks do is it decreases your ability to understand the speech reading cues. And this graphic here is great because it says, you know, I can't hear you if you cover your mouth, or I can't hear you if you don't face me. So a lot of patients with hearing loss have found that with the mask situation that, hey, I need to go in and get my hearing checked. I'm not picking up those visual cues like I used to. So another sign, this is the 8th sign, is that you have trouble understanding every word in a conversation. So this is an interesting way to kind of describe it, is that what we're going to do is we're going to play a video sound clip for you. And first we're going to play normal hearing so that you can hear kind of what normal is sounding like.
Hi, Hadley. How's it going?
Good, Grandpa.
What'd you do in school today?
Well, one main...
Now we're going to listen to what a mild hearing loss sounds like.
Hi, Hadley. How's it going?
Good, Grandpa.
What'd you do in school today?
Well, one main thing was that meeting...
Now we're going to listen to what a moderate hearing loss sounds like.
Hi, Hadley. How's it going?
Good, Grandpa.
What'd you do in school today?
Well, one main thing was that meeting got canceled, so...
And here is what severe hearing loss sounds like. So this is a great representation of what hearing loss can sound like. This is a great example to kind of show your loved ones and friends so that they can know what the patient is going through. The 9th difficulty that patients report is difficulty understanding on the telephone. And with everything that's been going on lately, the telephone has been our primary mode of communication with our loved ones. And what is great with technology is that we have been able to, not only with landline phones, but with cell phones, to help communicate with our family members and use the hearing aids and stream to the hearing aids. There were many times throughout this past year and a half that I was able to help set that up for patients so that they could understand and hear their doctors or their family members. The 10th and final thing that we want to look at is if other people report to you that, hey, you're speaking too loudly. I've seen it actually happen in both ways. Patients speaking too loudly with hearing loss because they can't hear themselves, but sometimes they can speak too softly. So it is something for you to make an appointment with your audiologist so that we can check that. And if you have any questions, please feel free to reach out to me, Dr. Paige Gainey, at our Glen Lakes office. Our number is 214-987-4114. Thank you.